Okay, welcome to this training video. This is on the Belmont S8. This is the left-right convertible flagship, so with all the fancy features, the color touch display. So we'll go through all the features and functions of the chair, and then we'll give some links to various bits of information that you might want as a follow-up. So firstly, let's just mention infection control. Now, this is very important to use the right solutions as recommended by Belmont. Now, you will see we've now got on the screen there a copy of the recommended chemicals and solutions that should be used on the chair. So these are the recommended from Belmont. So follow the individual procedures. We're not going to go deep into what needs to be done in each case. Have a chat with us at Leading Dental to make sure you're using the right product and using it effectively, and also follow the instructions that are outlined on this document. So just keep that in mind. That's very important to keep your chair in tip-top condition and also keep all of your warranties valid. Right, so let's get into the training. So first thing you're going to need to do in the beginning of the day, is you're going to turn your chair on. So we're going to use this master switch here. Now what that does is that turns everything on the chair on. It isolates or turns on the water master control and the air master control. It turns on all of our electronics and our electrics. So we're going into this boot up phase here, you can see at the moment. Now, just let it go through that. Don't touch any of the hangers or anything like that, or you're going to put it into an error. You're going to lock out hangers and things like that. So let it do its full boot. Now, what we've got here is it's asking us if we want to do a flushing system. So we're going to choose short flushing there. You can skip if you don't want to do it, but you should do that every morning. So we've chosen that. Now, what happens is when you take the hangers out one at a time, you can take one or all four out. Now it's asking us there to start by hitting the foot pedal. So what we'd do is we'd find a tray or a vessel just to rinse those into. We hit the foot pedal down here, and then our little counter starts down. So we're doing just a 40-second fast flush there. If you do the long flush, it'll obviously do a longer flush, and it will also bring in all the spittoon and cup rinse features in the long flush as well. So we can pause or we can stop that by hitting the foot pedal again, and then we can put those back into the hanger. So I would recommend doing the long flush every day, and then you're getting a good flush out of the system. That would also mix in with your biofilm treatment procedures, which again, we won't go through now, but they're very important. We've got those on other videos. So just bear that in mind as well. Okay, let's go through a really quick overview of the doctor's console here. Now we're just going to go through really basic setups, and we'll come back later into the more technical features. So let's start with our water control knobs. Now we've got 1, 2, 3, 4 knobs here, yeah? Now that lines up to 1, 2, 3, 4 hangers here. Now bear in mind that the hanger number 1 is the second in. So that's handpiece lines, 1, 2, 3, 4. So number 4 is far right. So work from 4, 3, 2, 1 backwards from the far right is probably easier. Because over here, we have 2 more knobs. We've got a blue and a yellow knob. Now the blue and the yellow knob line up to the triplex syringe. So triplex syringe, blue and yellow knob, and then 1, 2, 3, 4 on the hangers here. So far right is number 4, 3, 2, 1, moving backwards from the right. Okay, so under here we've got the water bottle. So when we're in water bottle mode, everything that goes in the mouth is going through our water bottle. So the handpiece lines, triplex syringe, and the cup fill, all going through the water bottle. We can actually pull this little lever here, which switches from mains water or bottled water. So I would recommend for biofilm control, you should always be on the bottle. We've got our bottle depressurizer here. So what you can do is flip that little switch, and that pressurizes our bottle up, and then turn it off to depressurize to fill up. So that's our basic control there on the water bottle, all fairly simple. Okay, so we've got under here what used to be called an oil catcher, more for just water. So what you can do is just unscrew that little container there, and in the old days, we used to have probably more chance of oil in the handpiece line, so it would gather any there. So all the exhaust air goes through that. These days, you're not going to have oil in handpieces. It's just not going to happen. Any excess oil will get caught up in the autoclave. But if you've got an O-ring that's faulty on one of your handpiece lines, these are low rings here are what separate air from water going through your lines. So if you've got a faulty O-ring on a motor or even a handpiece that's got O-rings on it, it can allow water to slip into your exhaust air and then it will end up coming through here. So if you see that fill up with water, it's a chance that you've got a faulty O-ring on your chair. So look, that's probably all we need to really worry about in here. You've got a height adjustment on this here, but that's something that has to be done by a technician. We have to just undo a couple of little grub screws there and move that up and down to the height if you want that at a different height. Okay, so we've got a little knurled pin here. That's a locking pin which allows this, if you take that little locking pin out, it will allow height adjustment. So you can see we've got this doctor's arm in the highest position. You can actually drop down into a few different levels there, and there's a little nylon lock ring in there that locks it in. So look, don't worry about that too much. I would suggest you get in touch with us and we can help to adjust those heights if you do want the doctor's tray at a different height. But you have got that adjustment if you need it, which is good for reference. Okay, now just be aware with these hangers. The hangers have a little insert. Now these little inserts are autoclavable as well. We can change them for different diameters. They just pull out. There's a little releasing pin down underneath, or a little lug we pull back. They come in and out, so you can clean in there, you can autoclave them. And if you've got different size hangers, we can sort of change them over. So they're all sensor controlled, these. They're a really good mechanism, so we've got none of those little arms or anything that can be problematic. It's a good sensor control. Okay, we're going to go through a quick overview of the manual buttons on here. So we've got 4 arrow buttons. Arrow up, arrow down is chair up, chair down. Arrow left, arrow right is backrest up, backrest down. All fairly simple. Right above that, we've got a little selector button there, which is only relevant if we've got electric headrest. So we push that button only if we're switching between an electric headrest or chair movements. Above that, we've got presets. Now 0, that's our entry-exit level. So we hit 0, usually lowest position, backrest up. We can preset that if we want. Then we've got 2 user programmable presets. So let's say we want to set a new position for number 1. Let's manually drive the backrest down and the chair up a little bit. We drive it into the position we want. And then once we have it in the position we want, what we're going to do is we're just going to hold down the number 1 button in this case because we're presetting that. Now we hold and we wait. Now when we listen, hopefully you can hear that. We had a little musical tune there and a beep, solid beep. That means that is now locked in as our new program number 1. Now next one is LP. Now if we hit LP now, we'll see what happens there. You'll see the chair height doesn't move, but the backrest comes out. Now that is user settable as well for the position of that backrest, but it's usually used for a spittoon rinse. So sits the backrest up. Now when we hit LP again, it goes into the last position the chair was in. So it doesn't matter how fine-tuned that position is, it's going to remember the last position before you hit that button, return you back to exactly the same spot. So it's great for a rinse position. So set them up, bring them straight back down. Okay, so we're going to start on the colour display here. So we're going to have a look at those 4 major tabs there we've got in the middle. So the first one is our just light on and off. Pretty simple. Light on, light off. So it's manual control. Second one's a timer. So if we have a look at that, we'll see we've got 4 different timers there. So they're all settable. You can set them as individual. You can change the tones. You can save them. And you can also label the timers. So have a bit of a play in there. That's fairly simple. You can change that. You can go back to the home button at any time, hitting the bone or the hitting the home or just the back button to take us back. So third one in, we've got our cup fill. Pretty self-explanatory. Hit the cup fill comes on. There are settings in there that we can either link it with the spittoon rinse so they both come on, or we can unlink, we'll go through later. And then we've got bowl rinse right next to there. Again, not much explanation there. Then we've got our settings tab at the end. So that's where we deep dive into all the back end settings. And so we'll go deeper into that soon as well. Okay, now we're going to move on to the top row. So you see we've got patient there. We've got 3 different options on that. So if we have a look, you'll see adult, elderly, and child. Now, you might have specific settings that you use for children that are different than elderly, for entry exit, for presets. So you can actually have different settings for each one of those different patients. That gives you a whole lot more presets so you can lock in there, which changes all of those buttons to have different presets, 3 times the number. So we can also set up the users there. So if we click on users, you've got your users in there. Now it's all fairly simple. We can go in there, we can change the names. You've got basically a copy paste sort of situation where you can copy paste the presets into other users. So you can have multiple users in there. We set them all up, and then those settings apply to presets. They apply to whether you like the water on, whether you like the water off, the presets you have on motors and scalers. So you've got a wealth of information in there that you can set for multiple different users. So we can see Sam's got his own user there, and it's just a matter of going in and choosing a different user, and you're good to go. Okay, so bottom row, let's have a look there. So we've got light settings there. So there's a heap of light settings. Have a bit of a look through them. You see manual on, manual off sensor, keep the light on, keep it off. So different settings there you can choose if you want to override the auto settings. Generally full auto is probably the best situation. We've got a lockout here. So let's say you want to keep that tab from being accidentally knocked or from a kid grabbing it and changing the settings, then you can lock that out. And it tells you how to unlock there. Just follow the instructions on the pad. And you just hold down and bam, we're back into full mode again. So heater on, heater off. So there is a mode there for cup fill heater, so you can choose to turn that on and off. So in the middle of winter and we've got someone with sensitive teeth to cold, we can just turn a little heater on there. So it's all fairly straightforward. Okay, so let's do a bit of a deep dive into the settings tab now. So if we hit our settings there, you're going to see there's a number of functions. First one is flushing. You're going to see that screen every time you start up the chair. So we don't really need to explain that. It's just a manual version of what you see when you start the chair up. Handpiece. So if we click on there, we're going to see that we've got drive air pressure first. So what we can do is hit drive air pressure. If we pick up a hanger and hit the foot pedal, you'll see the pressure come up on the screen there. So it's giving us an indication of what pressure we're going through our handpieces on the screen rather than using a gauge. So that's pretty awesome. Next function there, spray mode. We've got 2 or 4 mode. So it means that we turn our mist air and water on together and then mist air and water off together. Or we can have mist air on, water off, mist air on, all the different functions and variations with the mist air and water functions. So usually we just have it in 2 mode. Mist air, water air on and off. So water on, water off. So there is more functionality there if you need it. Handpiece light application. Do we want the handpiece light to come on when we pick it up from the hanger, or do we want the light to come on when we hit the foot pedal? So you can choose that in there. Next one is micromotor brightness. So if we pick up the micromotor there and hit the up and down, you'll see the light intensity go up and down. So I would imagine most of the time you're going to have it on full intensity, but if it is a bit bright with the new daylight balanced LEDs, they can be bright, so you can turn that down if you want to. And now we're going to language. We don't need to worry about that. That's pretty self-explanatory. Cup fill. So we can either interlock the cup fill with the bowl rinse, which is my preference. It means that when you hit the cup fill button, it actually also then runs some water into the bowl. So if you're filling up the cup, then you probably means that the patient's just had a rinse or they're about to have a rinse. So it's a good idea to flush the bowl as well. So I think that interlock is a good thing to have on that one, but you can make that decision for yourself. So we can also adjust the flush time there of the bowl rinse. So you just go in there and adjust that, all fairly self-explanatory. Of course, we just hit OK or save in all these functions if we need to lock that in as a preset. So going back to our main screen there again, if we keep going down, we've got timer control panel, all sorts of things you can change there. The music, something more intense, something more romantic, so you can choose whatever you want in there with your volume. And at the bottom there, we can turn that on or off for our volume or our keypads. And we've got one more setting at the bottom of the tab, which was sleep mode. That's just the sleep mode of the panel here, so we can have that turn off after a preset time as a power saving mode. So that's that one. We've got emergency cancellation. We don't really need to worry about that one. It's not linked to anything at the moment. And with service mode, so that's something we'd get into as service technicians. So you don't really need to worry about that one either. So that's in a nutshell the main functions on the display. Okay, so we've gone through our functions on the display. Let's go through what presets we've got now when we pick up one of our various handpiece lines. Let's start with a high speed, or what we've actually got is a air turbine line. So this one's got a high speed coupling attached. This one here is just a Midwest 4-port, what we call, but it's got a Midwest 4-port connection and also our optic terminals. So we can screw any sort of coupling or air motor onto there. And essentially when we pick up one of those air turbine lines, brings up this screen here. This is one of the unique things about this chair. It's an amazing feature, something which is usually reserved for more electric motors. We've got this speed control on here for our air, or our air intensity. So what we can do is we can have either a fixed or variable mode where we adjust the intensity or the actual amount of airflow going to our handpieces, which is essentially then decreasing the speed and the power and the torque. So if we have a particularly high torque handpiece that uses a higher air pressure, we can have that up at max, but then for a less intense pressure for a handpiece that might not take such a high pressure, we can actually drop that back down, or if we do need to for some reason want to drop the speed. So that's quite an amazing feature to be able to have that on our air turbines. This is an air turbine, not electric motor. Now, we've also got on here, we've got a fixed mode there, and we can also change the fixed mode at the top from fixed to variable. So if we hit variable on there and hit OK, we can now vary that speed by sliding the touch panel, or the foot pedal, I should say, down the bottom. Now, it will go from 1 right up to the maximum setting. So if we set the maximum setting at 6, now we can slide our foot pedal from 1 to 6. So we've got that safety that it won't go above the maximum setting, but it will give us that variable control. We've also got 4 presets there, M1, M2, M3 and M4. So we can set our 4 favorite settings on there. They might be 4 favorite handpieces. We might have our max super powered handpieces, number 4, max power 4. Number 1 might be a more delicate airflow. So, and then down the bottom of that, we've also got our optics on and off light there, you can see. Optics on, optics off. Water on, water off, and air on, air off. Now, our mode that we went through before, you can, at the moment, air and water both on and both off. Or we can change that through to 4 mode, which means you can have air on and water off, water on and air off. Now, when we're talking water and air there, we're talking our mist air, our chip air. So that's what gives us our water spray. We've got our jet of water coming out, that mixes with air, and that gives us that nice little mist. They're the things that we're controlling on that touch panel there. On the bottom right there, if you click on that, we'll have a look. There are a few different functions there that are also available while we're in that screen. Things like light controls and timers and cup fill and bowl rinse. So they're all accessible while you do have a handpiece in operation as well. Okay, so we're going to go through the endo functionality. So we've got a NLX Plus motor here, which means that it does have endo functionality. So if we drive our speed down below a certain threshold, you'll notice all the torque settings now come in. Now, if we want to adjust the torque, we just click on the little torque button there, and we can adjust our torque. Now, the torque has a maximum torque of 3 Newton centimeters. Now, I would suggest using only a 1-to-1 handpiece because the torque values are going to be accurate on a 1-to-1. At this stage, I can't guarantee. I do want to follow up with NSK and Belmont to check if any other of the handpieces can be used, but I know for a fact that with the NLX Nano, that with a 1-to-1, the maximum torque range is 3 Newton centimeters. So that's a safe one to use, 1-to-1 with your torque range set up there. We've also on the other side got our auto reverse, our auto forward reverse, and then we've got all that functionality off where it just comes to a halt. So there are different variations that we've got within the endo handpieces, all in there. We just hit OK and those are locked in. So we've got our forward and reverse on the bottom there. So that's for all the motors, reverse, forward, water air, all of those controls as normal. So we've got our 4 presets there at the top again. If we want to save them, we just hit the bottom right control button, bring up our save menu, hit save, and then we're locked in. And it saves all of the water controls, everything all into that setting. Okay, so we're going to go through our handpiece operation here for the scaler. So basically what we've got is we've got our adjustment there. We can go variable or we can go fixed again. So we're in variable mode there at the moment. So in variable mode, we can again set our maximum. We can set our maximum setting on there. And then our little slider down there can slide between our minimum up to whatever we set a maximum at. So that's great if we know that there's a maximum power setting on a handpiece. We can set that up and then we can slide between that. So with the scalers, you can only adjust the power with the foot pedal up. So if the foot pedal's down, the power won't adjust. So if we need to adjust the power, we just take our foot off the foot pedal, we slide, adjust, and then when you hit down, it's going to go. Probably with the scaler, I think it's probably best to use a fixed mode. So if we go from variable on to fixed mode there at the top, we go into fixed mode, then you've got no chance of accidentally changing the power. So it's just a manual set of the scaling and away we go. So you see we've got perio mode, endo mode and scaling in there. And then of course we've got our settings in there so we can go in and go down the bottom there and hit save and lock in that setting. And it's going to hold that setting until you change it as our default setting on that. So that's our scalar control, all fairly straightforward. Water on, water off, power intensity on the screen there. Okay, so let's go entry exit into the chair. So we've got our nice little armrest here. So it's just a gentle lift and twist to turn the armrest. So we've got our different lockable versions there. So for our entry exit, we would pull the armrest out. It's a nice solid armrest, and then we turn it back for the patient. Then what we do is we can hit one of our presets on the chair there. Now, you'll notice there that the chair wouldn't move in that position because it's got to be in a safe zone. It won't let you hit one of the presets and lower the chair onto that doctor's tray. So you need to have it out. And then same in reverse. If you're trying to sit the chair up, but the doctor's tray is in the danger zone, you won't be able to use any of the presets. So what we do is we entry exit. You hear that little ding there. So it hadn't quite got to the full position that detected that the doctor's tray is behind. So just be aware there is presets in there that do lock out the functionality of the chair if it is in that sort of danger strike zone. Okay, so we've hit one of our presets there. We've laid the chair back. Then what we need to know then is just our foot pedal controls here. So we've obviously got our go pedal. We've got our slide functions that we've gone through there for all of our settings. But then we've also got the blue knob here, which is our water on and off. This one here is a chip air. So if we hit this knob here, we're just blowing a little bit of air through. So it's giving our chip air or our mist air. So it's if you've got a handpiece with water flow control, with air and water, you can blow a bit of chip air through there without picking up a triplex syringe. Just gives you a bit of air on that in that zone. Okay, so we've got a headrest here. So this is a double articulating headrest. So we'll just put this chair back up into the 0 position, which will be relevant for entry exit. Now they've got a really nice little one-touch control now on the new headrest. We've got one little push button at the side there, so we can take the headrest down for children, down on itself. And we can also reverse it. If we've got a wheelchair, we can sort of reverse the headrest back and do a quick consult in the chair if we've got room to bring someone in from behind. And then the height movement there, it's another one-stop push. We just push that little knob on the side and it's feather light for moving that up and down. Okay, so we're going to move over to the assistance side. So we might as well start at the top and we'll work down. So first of all, we've got our cup fill there. We don't need much explanation there. We've got our pivoting spittoon bowl there. So that does pivot in and out. So we've got that nice little motion there. We can remove this bowl. So I do recommend running a bit of water in so that the rubbers in there are all sort of moist and it allows easy removal and in and out. So this is all still clean, brand new, so we can touch it without gloves. If you have a look, and then just when you put it in, just wiggle it in gently and have your hands underneath, just gently coax that in. Don't put any undue pressure on there. We've got a little ceramic cap there, and we've got a little basket in there that can be cleaned out. So that's up there. We look down on a console here, and we've got our on-off switch here, which we went through already. Here we've got two little quick connects. So there are some little male fittings that go into here. This one here is for air, and this one over here is for water, and it's also got an adjustment knob. So that's for third-party devices like air abrasion, polishing systems, all those sorts of things. We can plug straight in there. So it's just a little gentle push on that, releases this little attachment here. It's magnetically held in there. Under here we've got triplex control there, air and water. Again, blue for water, yellow for air, and then we've got cup fill and bowl rinse. We can adjust the flows here. So we've got our two baskets here for our suction lines. So again, they're nice and clean now, brand new. Usually you'd be gloved up. So the little filter basket does come off. You can replace that, or just empty it out daily. Once it looks like it needs replacing, they're quite a cheap consumable item you can replace. Also, there's an O-ring on there, daily maintenance, or I'd say probably weekly maintenance. Get some Lubrijet drops. So we will have that in, we have got links on different videos with the drops for lubricating all of your O-rings. So we've got our two filters there. We've got our controls up there, so we just flip that up when we need to. We've got our handpiece lines here. So let's come back now and we'll have a bit of a look at our doctor's control. Now we can ratchet that up. So if we just move that whole arm up, it just pushes up. Click, 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 click. Now there's a little knob under here. Now we push that knob to release. Now you won't knock it, you need to lift it slightly to take the weight off it. Push the knob, it'll go back down, and then you ratchet it back up. So it's ratchet up, push the knob to let it back down again. So nice little control on there. You look that on the button on the top here, we've got a replication of the presets we've previously talked about. We've got our light on and off, which turns our light on and off obviously manually. We've got, don't worry about the hashtag button there, we don't need that one. We've got cup fill, bowl rinse, and we've got our presets there, all very self-explanatory. So if we lift that doctor's control up again now, we can have a look underneath, or the assistant control I should say. We've got our removable inserts and also our holders there. We can put a fourth hanger in there if we want to, and that can be another suction line, so we can have 3 suction lines. So we could go as far as 4 as we wanted to, because we've got 4 outputs under there. So at the moment we're only using 2 of those, a high volume and a low volume. So the suction has had a major facelift on these new model of chairs, and they also have a 200 kilo weight load rating as well. So big increase in the weight load and also in the suction power there, which is awesome. What I do recommend, we've got separate videos on the suction line maintenance, but once a week I do recommend getting some Lubrijet drops. Again, they're a Katani product. That's my favorite for doing it. Pull everything apart, put some lubricant on the O-rings. Also, this small one here, very, very important, at least once a week. Pop out that little barrel mechanism in there. Usually you probably should turn the chair off, so we'll just turn that off. We'll pull out that little barrel mechanism in there. That needs to be cleaned and lubricated, or it will get sticky and jam. So again, pull everything apart, lubricate as often as you can. Anything with an O-ring on. The Lubrijet drops that we recommend, you can sort of got a little eyedropper bottle you can drop into all those mechanisms and keep them well lubricated. So that's all fairly simple and straightforward on the assistance side there. Now, just a little side note, this is a custom arm. This one's actually supplied by DCI, so it's not a Belmont part. It's one that we've just put on there by special request by the customer. You do need to be very wary if you are putting any sort of third-party arm on. If you do have any sort of clash with the delivery or anything like that, then obviously it's not covered under any of the sort of warranties, but we can add those custom brackets on special request. Now, also important to know that this is not designed to have a heavy load on it, as it says on the top there. No more than 1.5 kilos. So you can put a few instruments on there, but nothing of any sort of load capacity. Okay, so we'll have a quick look here under the hood, so to speak. So if you lift this little tray here, We may ask you one time, or you can check yourself in here, you can check your air and water pressure just to make sure that our pressures are set adequately. If your air compressor, say, isn't turned on, we've got no air pressure, it'll lock out all the functions on the chair. So we always get you to come and check the air and water pressure. So that's a good place to start. There's a black knob here, which is for isolating the water control. And there's a little knurled knob here we can turn and release a bit of air pressure if we need to. And some fuses. We wouldn't be expecting you to ever touch those fuses. That's a service area only, but it's very, very, very rare to ever need to change one of those. So yeah, under the hood there, that's just one more function to be aware of. Okay, so let's have a look at the light. So first of all, we've got our seamless sensor on the back here. So we just wave on and wave off to put our light on, put our light off. Now, if we want to go into composite mode, we just hold our hand on the sensor there. Turns off the 8 white lights and turns our 2 yellow ones on. Now, the easiest way to get back is we just wave off and wave back on again, go straight back up to full brightness, or whatever the dimmer is set at here. So we just wind that little dimmer there, and we bring our brightness up and down. So we've got our seamless dimming there from minimum to maximum on the back. Now, this would have to be the best light on the market. We've got this amazing ring of LEDs. So even if we cover up a number of those LEDs, we've still got really good shadow control there. So we've just activated the sensor there. But so the puppy there is actually covering a number of those LEDs, but our shadow control is still quite amazing. Okay, now we're going to go through the left-right conversion. Left-right conversions on these chairs are super simple if you know what you're doing. Make sure you always follow the manual. Once you've done it enough times following the manual, then it will be second nature. You'll be doing a conversion in about a minute. But you do have to follow the steps correctly. So let's start with the manual here. First of all, it says move the chair down into its lowest position. Make sure that the backrest is up. So we've confirmed that lowest position backrest up. Then it says to isolate the chair. So what we want to do is just turn the chair off the main switch there, just to turn the power off the doctor's tray. That makes it all nice and safe and ready to go. Right, now step 2 is just to release a little pin under here for the light. So what we do is we reach under here, we've got to lift that cushion, lift the cushion up with that little pin there's been released. And then we can just gently move our light through. Now we've got an additional arm there to be wary of. Also be aware what your light up the top is doing. Don't let it swing around and bang into anything. So we lift our cushion up there slightly, we move that around, it's going to click into place there. Now that arm in this particular case, custom arm, so we're not going to worry too much about that. But then our light just pivots around here, goes into our new position, and then we move that. That's our light done. So that's okay. So next phase is we just want to move that little arm across here. So again, this is all in the manual, but what we want to do is just get this arm here and we just swing it around. We move it in tight in there. Now what we're trying to do is we're going to create a nice flow for our doctor's arm to be able to move past. So we're going to do that. And then what we've got to do, we've got a little pin on here, which is down on our arm down here. So let's just have a look where that pin is. So there's a pin down here, we just pull out. And what it does is it pulls out and then we can rotate it a little bit and it'll stay out, yeah? And then when we're finished, we can rotate it and it'll drop back in. If that pin's a bit stiff, this whole arm can move sort of out of alignment a little bit and it can jam. So just give it a little bit of a jiggle and a wiggle and it will free up that pin and it'll come out. So it should be nice and loose. So just move the arm a little bit if it's tight. And that's that phase done and dusted. Okay, so next phase is just to move the doctor's control over. So we just make sure that we're clear of all our cables and hoses and that sort of thing. Make sure we're in the bottom position as per the previous steps there. Make sure nothing catches as we come across. And everything should just glide straight across. Again, follow the manual. Everything should flow smoothly. And just make sure that nothing catches anywhere along the way. Okay, next step, we take the little back cover off down here and we lift our little pin. So pull, it's just a little clip release there. There's a pin there, we just lift it. Now what I'd recommend is lift it and then move the doctor's tray slightly and that'll hold the pin up. And then when it gets back into place on the other side, if we push it back now, we'll notice how it drops back into the hole. So that's what it's going to do on the other side. So we just lift that up and release and get that ready to go. Okay, so everything's in place now. So what we need to do now is really carefully just move everything across. We need to be wary all the time that we're not catching or jamming anything. We want to move this whole delivery out into like a 12 o'clock position. So we're putting it all straight. We need to pivot the spittoon bowl around the other way and bring it out straight out, watching our delivery arm doesn't run into anything. So our cup fill's going to be sort of facing the chair. And then what we need to do is we need to make sure that that delivery arm here, the assistance arm, is on the side of the chair that it's moving to, which it is. So then we just move the whole mechanism around. As we go around, just make sure that our hoses and all down here aren't sort of jamming and that they're moving across, and we can just double check that that's all good before we put the covers on. And that, you'll notice that pin there is going to lock back in once it falls into position. We'll just give that a bit of a twist, and there we go. That one's dropped into position. Then we're going to go around here and we're going to lock this pin in here as well. So this one here we just twist and it just falls into position there. So that's our two lock pins in. And then all we need to do is just sort of clean up all the lines, make it all nice and neat. Once we've done that, we clean up our lines. We'll check under here and just make sure all our hoses all look nice and they're not twisted or jammed. And then we put our cover back on. So have a look in the front of the cover. You've got two notches here. So it just clips onto the one tab there. So it'll be a different one depending on whether it's in left or right. And then it just clips back on. And a push. There we are. Pushes on. And we're all good to go. So look, it's not a change you're going to be doing all the time. The doctor's tray here will also just come around into position as per normal, and we're back ready to go. So it's a fairly quick, seamless transition once you get used to those motions, and it's not something you'll be doing between every patient.